Good afternoon, everybody. Thank you for being here. Let's go through some data, update a couple items, and just take some questions. Unfortunately, we lost 4 members of the community over the last 24 hours. All 4 deaths were in the hospital. Female, 68. Male, 88, 74, and 69. Obviously, we're thinking about the families right now who are mourning. We've now lost 611 residents of the community during the pandemic directly related to COVID-19. So very, very sad. Looking at cases, positivity data, 7-day average at 3%, going in the right direction. Really remarkable if you think about where we were in January, 30 days later, where we are today. Hospital numbers are down again today, 122. I think we're down 6, I think. That's down 49 since last Monday. ICU's at 30, so up a little bit in the ICU. So please keep these members of our community in your thoughts and prayers as we need them to get better. New cases, we have 147 new cases today, so I think we're in a stretch now where we're seeing caseloads in the 100s, much better than where we were. Hopefully this week we'll crack that number and get into single digits again, or double digits, not triple digits. But again, we knew during the winter time we're going to have elevated cases. I think what we saw during the surges in Halloween, and then certainly Thanksgiving, and then Christmas and Hanukkah and Kwanzaa and New Year's wasn't triple-digit increases. Remember, in October we saw cases doubling from Halloween, and then we saw cases doubling from Thanksgiving. That didn't happen. We were prepared for it, but it didn't happen. So we're down here. I think if we can get this into double digits, I think that's pretty good for us during these conditions. We'll see. 6 out of the 147 are senior residents. Again, that's something that we watch. Why do we watch that? The data shows seniors are more likely when they get this virus to end up in the hospital and have a bad outcome with this virus. So certainly we've seen the senior facilities, which have been a big contributor to hospitalizations, loss of life, we've seen the numbers get better there. We think that has to do with the vaccine. Most of these facilities have now had, these residents have now had 2 doses of the vaccine, so that's good. Active cases are down to 2,082. That's a good sign. January 3rd, we were over 6,000 cases. So now we're at the point where it looks like we're flipping the script a little bit. We have more recoveries each day than we do new cases. Hopefully we'll be able to keep that trend going. Looking at testing, I think right now one of our biggest concerns is that the community continues to utilize testing. You get some good data days compared to where we were. We're making progress. Let's not get too comfortable, especially when you have symptoms. How before we had the real October Halloween disaster, we started to see symptomatic spread more, where folks were just kind of going to work sick, doing things sick. We can't get back into that pattern. So please, if you have symptoms, we have appointments ongov.net/Cayuga Medical, Monday through Friday, 9 to 2 at the F Shed in the regional market. Again, on weekends, we have symptomatic testing at Essentia Health, 1050 West Genesee Street, 8 to noon. Again, the same registration, ongov.net/Cayuga Medical. So please take advantage of that testing. We have asymptomatic rapid testing still going on at the On Center. And that's a Monday through Saturday now. We were doing Sundays, but the demand has really fallen off. So certainly we can do Sundays again if people if we see the demand on Saturdays filling up. So again, but that's here at the On Center. In addition to that, we've gone out into the community. Today we're at the East Syracuse Village Hall and the Northeast Community Center. The Northeast Community Center in the Holly Green neighborhood of the city of Syracuse. A lot of our refugee communities live near here, and it's something that we've always wanted to get testing done in hard-to-reach communities. With the pandemic, we've been doing this weekly. Tuesday, we'll be at Shove Park in Camillus. Wednesday, we will be at the Fayetteville Village Hall, the Clay Senior Center, and the Moyers Corners Fire Department. Thursday, Onondaga Town Hall, and Friday, Lafayette Community Center. Certainly, we'll continue to proactively offer testing in the community in all corners of the community so we can continue to hunt for hidden pockets of the virus. On the vaccine, before I go into some of the details, just a reminder about this process. It's amazing, the questions, so we want to just kind of be repetitive on this. So the eligibility is set by New York State for who qualifies for the vaccine. The when is weekly to a degree based off of supply of the vaccine, and the how is there's different locations on how, where to go. I understand it can be confusing and it's frustrating, but we have a pod at the On Center where we schedule appointments on a weekly basis, and we won't schedule appointments till we have vaccine in hand. The fairgrounds has a pod. We partner with the fairgrounds. We help staff it. They have set up appointments into the future. So if you have an appointment, you have an appointment there, show up. And then our pharmacies work with the seniors, Kinney Drugs being the lead pharmacy here in Onondaga County, and they are scheduling appointments as well on a weekly basis. So those are all positive things. When it comes to our pod, we've done 16,293 doses. That doesn't include today. I'll give a breakout of first and second doses on Thursday, but most of those are first doses. Today we get into this week, a period of time where we have heavy second dose days. Last week they were light second dose days. So that's something that we're going into. A reminder, you will be emailed your date and appointment time of your second dose. Look for the email from COVID Vaccinations. If you didn't provide an email, we'll probably call you. We will call you because we have your phone number as well. And again, if you received Moderna on your first dose, you'll receive Moderna again on your second dose. Same with Pfizer. You can't go to different locations for first or second doses. You need to go to the same location. On list, we started this last week. 10,000 folks on a pre-registered for a waiting list that would then be pulled from each week as appointments became available. It's important if you're on list that you check your emails a couple times a day, and we really need you to do that because, for example, when we get 900 doses of Moderna, often we can get extra doses out of that. So if we had left over from a clinic because they got 900, we had 900 appointments, there's 60 extra doses. We're going to likely go to the on list then to get those 60 individuals out. We pull the random process. We send out emails to you to say you've been awarded. We really need you to check the email more than once a day because that's how fluid this situation is. So please check your emails a couple times during the day. So if you're selected with on list because we have 80, 90, 100 doses available and we want to do a small, quick clinic, that we do that. Today we did a small clinic off of on list for 90 seniors. We were able to pull an additional 90 doses, and so we did a clinic today for 90 seniors. So please do that. The phone banking today for on list, the remaining appointments, it was busy. I know that they had 8,000 calls in the first hour. I don't know if there's any more appointments left. But again, this is a process. We're working through it. It's a pilot program. It seems to be working. So we will take a look at this, start getting through this 10,000 as vaccine becomes available. Then maybe we look to expand it on that. Last week, I was here on Thursday, a day which we opened up, I think 900 or 1,000 appointments, and needless to say, it was very busy. The website was visited 801,000 times by 152,000 unique IP addresses within a short period of time. To give you context, the previous high our website had been visited was 270,000 visits on January 20th. We worked with the third party to ensure that the volume that we saw on the 28th will be handled potentially this week if we get vaccine in hand. We've quadrupled the server capacity. But what this doesn't change is the following. If we have 1,000 doses this week and there's 65,000 eligible people and you have 150,000 IP addresses trying to get those 1,000 appointments, there's still going to be many, many disappointed people. And you can click on the application thinking you're going to get through, and by the time you're through, realize that somebody else did that at the same time and they were just faster. And so I think we've addressed the issue that the system is not going to get overwhelmed. You'll find out faster that you did not get a slot, but that does not change the issue that we have too little supply for compared to eligible people who want the vaccine right now. And again, that's just something that this is going to be a grind. Each week it's going to get a little bit better. Eventually we'll get Johnson & Johnson on the marketplace as well with Pfizer and Moderna. That will be new vaccine supply into the states, down through the regions. That's when I think we'll start to see things pick up a little bit more. The state said we'll get 16% more. Unfortunately, I think that's 16% more off the 1,000 number, not restoring us to the 3,600 that we had before the state was cut. I don't have full confirmation of that. But again, for us going from 1,000 to 1,200 doses means like we're working an extra hour that week on new shots. So it's not enough to meet the demand. And this is just where we are, and we're just going to have to get through this together as a community. Nobody's going to get left behind. Our administration, this is the most important thing we'll probably ever do. We acknowledge that. We wish we could do it in a weekend, but that's just not possible. Case investigation reminder, as important as the vaccine is, it's important that we continue to limit cases. How we do this is we box in the exposure, we box in the virus quickly with our investigation and then contact tracing. Again, if you get a text from 833-634-1564, that is us asking you to participate in that investigation process. The faster we get that done, the faster the contact tracing begins, and we're able to box in potential contacts that had exposure. So thank you again, the community, for that. Another topic, due to the positivity rate lowering in the right direction, on Thursday I'll put forward what our library reopening plan looks like for our city branches, and we'll go through that on Thursday. I think now that things are going again, we can do these things, do them safely. So we'll get the city branches opened yet. I'm waiting on the executive director to finalize his plan to me, and then once we look at it and approve it, we'll let everybody know what that will look like. We still may do phases. It still may be appointment only for a little while, but then eventually we'll get them fully running as we continue to make progress in the pandemic. Saying that, happy to take questions.
Regarding vaccine appointments with the weather, upcoming weather, The governor announced a state of emergency, and he just added Onondaga County to that. There's obviously been some vaccine cancellations or postponements downstate, but should we expect any vaccine cancellations for weather here in Onondaga County?
Yeah, I mean, today, obviously, we're in pretty good shape, right? It's not even snowing. But that's a day-by-day process. I think what the Hudson Valley and New York City and Long Island are looking at is potentially not a 10-year storm, a 20-year or 30-year storm. So that's not what we're looking at. We're looking at maybe some extended snowfall of an inch per hour. An inch per hour, we're very comfortable with being able to get the roads plowed. An inch and a half per hour as well. 2 inches per hour, things change. So the question then is 2 inches per hour for an extended period of time or just a little bit. So we'll watch it, but it looks like we're not going to be in the same position they're in. We want to keep our vaccination schedule going. We'd even take redirected vaccine this week from the other parts of the state if that was an issue about the integrity of the vaccine potentially to keep up with things going. We would take more this week to get that done if the state wants to do that as well. So it doesn't look like we're going to see the type of storm that they're seeing. But certainly if something changes on that, this is something that we watch and assess by the hour.
Does the county or city prioritize making sure roads around the vaccine sites are cleared before?
Yeah, so with the on-center, you're coming right off the highway, so depending on which way you're coming from, it should be okay. Certainly, these are city streets. If the city street hasn't been plowed, we do have some plows that we could get State Street done ourselves if we had to. So we understand that many of the residents coming here are seniors. We will have more staff ready to help our seniors get into the buildings, out to their cars if necessary. You come here every day. We do a pretty good job of blocking off traffic there. So that's something that we'll continue to do if the weather is a constant snowfall and we're still vaccinating.
And just last question with that, even though we're supposed to get less with, than downstate, but, obviously snow is not unexpected here in our area. It can happen even if it's not going to be from this storm. So the state is rescheduling any appointments that they canceled. Would that be a similar process here if appointments did end up having to be canceled? What would that kind of look like?
Yeah, so the only appointments that we'd really be looking at canceling would be second doses. And so we would reschedule, but again, we don't set up appointments weeks in advance like the state does. They can do that because they control the vaccine. So they can say, I'm going to have appointments till April because I'll make sure my sites get vaccine. We go on, it's not even week by week what we do, right? We're going to see if we physically get the vaccine tomorrow. If we physically get it, then we will look at what day we want to do our clinic, or maybe 2 days. Because Thursday, Friday would probably be the days, but Thursday and Friday are heavy second dose days as well, so we might do 2 days instead of one. But again, that's all dependent on the vaccine showing up tomorrow like it's supposed to.
So in terms of the new appointments that you'll be adding for later this week, I'm sure people are intensely interested. Those will probably go up tomorrow afternoon?
So tomorrow, Tim, we'll physically get the vaccine, and then we'll look at what they're looking at. It's most likely going to be a Thursday, Friday appointment schedule, but those appointments will go up, whether it's tomorrow afternoon or Wednesday afternoon. We'll let people know as soon as we physically have the vaccine. I don't even want to set expectations because if the vaccine doesn't show up, there's nothing to talk about.
And tentatively, you're thinking it's 1,200 doses?
Yeah, so probably the appointments available will be less. The state has asked us to focus in on specific residents with developmental disabilities. So there's 200 slots that they've asked us to try to micro-target, where we're going through that process. So we're probably looking at 1,000 doses, potentially for 1,000 appointments, maybe even less if we draw from on list. And then we will have new appointments for 200, but those will be for members of the community who have developmental disabilities that we're working through with our partners. So how many go up online like they have in the previous weeks is still a number that we're going to determine, but needless to say, there will be 1,200 people being vaccinated from our pod this week that are new vaccinations. And then we'll know more what Kinney's going to get for new vaccinations too, and then certainly seniors can go, if they get new vaccine, which they will, they'll use on list, but then they'll have their other available appointments as well. So more to come. We're all in the same boat because we just we don't know what vaccine we get till we physically get it. And certainly if the state wants to send us more, we'll do more. And I've offered to do more on a redirect, where we'll even do more this week and take less next week if that works out with the state distribution, because things are so bad down in Long Island or New York that they can't vaccinate for a number of days. We'll do more up here if they want us to.
And as of now, you're doing second doses every day also?
Correct. This will be a busy week with second doses. So this is one of those weeks where we got our own supply in the beginning and redirect from hospitals. So I think we'll probably be doing at least almost 1,000 every day this week for second doses. So doing a lot for second doses this week, and first doses, at least if we get the supply. And then you never know. We work with the state, and the state says we want to do a pop-up clinic somewhere, we'll go do it. We'll continue. We might have one or two of those too. We'll see what they say.
So far, have you found pretty good follow-up by people coming for their second doses?
Yes.
Yes?
Yes, very, very good follow-up. And so we'll know more this week because we'll have a good sample. But last week when we were doing it, really, really good follow-up. Maybe even one or two didn't, and it was a mistake. Now they're calling us wanting to get it. So that's a good sign.
Have you asked about deferred doses because of the storm, or was that you asking just now?
No, I asked. Yeah, so I offered. We don't.
So I would assume that would have to happen relatively quickly if it's
yeah.
tomorrow, right?
Yeah. It's certainly they probably would find out more with how the storm performs over the next few days if you would have an issue. And again, storms, we're used to this, right, in upstate New York. I mean, these things happen. These nor'easters are here. For us, some of what other parts of the state or the country think is a bad storm, it's just a regular Monday or Tuesday. So we'll see how tough this storm is. It looks like it could be a pretty intense storm. And again, if there was a need to redirect and get shots in arms this week, we would do that this week and even take less in future weeks to help out other regions if that's something the state needs.
You asked that people on list check their email maybe a little more often than they have been. How did it go today with notifying people yesterday?
Yeah, so what we had to do is the emails went out yesterday, and we get to see, did the email go through? A couple of the emails did not go through. I think 88 out of 90 went through, 2 did not. So then we called, and then later in the day, looking at who's opened the email, we only had 25 people open their email. So then we're phone banking on Sunday, Tim. So we were phone banking to try to get this done. So we really need our folks on list. If you signed up a loved one, or if you're a senior, we really need you to check the email a couple times a day at least, maybe 2-3 times a day, so that in the event something happens and we get to you and your name gets pulled, you get your shot. Because if we get any vaccine, if we do a pop-up clinic with the state and they give us 1,000 doses and somehow we can pull an extra 100 or 200 out of them, we're going to go the next day and do that. So these are all things that this is a fluid situation, and for us it's week to week to day with it.
Were you able to do all 90?
Yeah, we got to them all. I think it'd be harder it was 200 individuals in only a certain amount of time, but we got to them.
You would hope to be doing a lot more vaccines than you're doing now, had the infrastructure, the capacity. How has that impacted staffing with the people that we assumed would be doing more of those vaccinations? Have you redirected them at all? Or?
Yeah, so, well, you know,
we
what
just
we're
waiting?
trying to do now is we brought on a lot of temporary nurses who want to do more, right? I think they're being patient just because there's not a lot more vaccine anyway. So we're spreading out who's working at the sites so that everybody gets hours, so everybody's happy. We have a lot of nurses who are volunteering. They've been great. But we built up, and again, this is the one part of the process that we thought was totally our lane. So, you know, it's going to be turned over to us, and we're going to run and sprint until we can't anymore, and then we bring in other partners, and that it just hasn't worked out that way. So we built up a lot of capacity, a lot of infrastructure that's being underutilized, partly because of production and supply, partly because of change of strategy.
The data trends are all pretty good lately, except for the number of deaths.
Mm-hmm.
Cases are down, the hospitalization's down. Do you have a sense that there's just enough virus in elder care facilities or otherwise that it's just hard to keep the deaths from occurring, or will those dry up too?
I think they'll slow down. Unfortunately, so today we have 4 members of the community, right? 68, 69, very young. None of these 4 lived in a senior facility, right? So these are just members of the community that got this. And I look at my ICU number, and I still know that there's more pain to come. And so I think until that ICU number gets in single digits, we're going to be in this boat for a little bit longer. And that's tough, right? We've seen this play out now through different periods of time, and we know what's coming. So, again, please keep those in the ICU in your thoughts and prayers.
I'm curious how you feel about non-sports extracurriculars returning. Do you think that they should be allowed to have audiences as well?
Yeah, I do. I think some of the other school-related activities that these young people are involved with, we've asked, again, in talking to different districts and what they need is they're remembering all these regulations and stuff that have happened countywide throughout the pandemic is difficult at times. So are there things we need to specifically be advocating for? But whether it's trying to figure out a way to get the arts and cultural pieces of these extracurricular activities back online, I'm very supportive of that. And how we can figure out a way to do it safely. It may not be the same, and we're willing to advocate for that. As we continue to make progress and we continue to vaccinate more educators, looking at some of the regulations that have driven a lot of the hybrid learning, should the desk be 3 feet apart, not 6 feet apart? These are things that we got to look at now, especially once these second doses start going through, and we start to see our education leaders get to high capacity on the vaccination front. I think once the adults are vaccinated and we continue testing in the schools, the in-person learning needs to really become more robust. So we're willing to look at all this, understand the data. Public health always on people's minds, but we've had so much success with schools and the workforce in the buildings doing such a great job that the kids in the buildings aren't spreading this. Will kids get COVID? If mom and dad continue to get COVID outside, the kids are going to get that as household contacts, and some kids will get it as well. But for the regulations, for the most part, stop those folks from getting into the buildings. So a lot of success with schools. I think we can get sports going. I think we get, I know that there's chorus, there's choirs, there's marching bands, mock trial. There's other things going on that folks want to get going too. And I want to see those happen as well.
How many second doses did you plan on doing this week, or we hope to do this week?
There, each day, so it's the same as we did as first doses. I think today we're doing maybe 800, around that range. I'll put out the specific number later today. But each day you have second doses. I think there's one day this week where it's a fourth week for Moderna, but the third week for Pfizer. We had a Pfizer clinic one day, so that's a busy day for us. It's a lot of vaccinating going on still. It's just not new appointments. And then eventually what will happen is we'll get through, when we were the heavy vaccinator, we'll get through all those second doses, and then we'll kind of be stuck in this ground of not doing a lot until we get more supply. And all the counties feel this way. I mean, this is what we're ready for, and to a degree we're on the sidelines. It's very frustrating.
Ryan, is Syracuse University still returning next Monday?
Yeah, I believe they've started to onboard back people right now, Tim, with testing. I think they all got tested at home, and then they're coming back through. And I think just like they were bringing back kids slowly in the beginning, that's what I believe they're up doing now as well.
And doing the same protocol they did in the fall, testing at home first?
Home first, when you get here, weekly. So there will actually be tens of thousands of more tests done in the community each week because they will be testing everybody weekly, not just the students but faculty as well.
And do you have any report on how they're doing with teacher-professor inoculation?
I know that we're vaccinating them. I know a lot of them come to our pod. I don't think education and higher education is going to be an issue with numbers from what we saw. We're going to send out another survey this week to get more data. I think we're going to have very, very high participation, it looks like. I think some of the other sectors will need to do more, and I think eventually we'll get them where we need them. But, with our law enforcement community, those who haven't gotten a vaccine yet, it's not because of access. Each week, the state access to target, we do, and we figure out how many people are still on waiting. We try to plug them in. But I think you'll see more. You might have 60 to 70% right now. I think they'll get higher, but it will take a little bit of a while after these second doses go through. I think people will get more comfort overall, and there's certain communities that just are not comfortable yet. And it will be our job once we can get there. It's tough to go into those communities and advocate, go get your shot, go get your shot, go get your shot, when you don't have a shot to give them, when they say, okay, let's go. And, 3 weeks from now, 4 weeks from now. So you got to have the supply be there when you're really going into the communities and pushing for them to say yes, because once they say yes, you're going to say, all right, let's go.
Put Onondaga County in a state of emergency for this snowstorm. What should people know about what that means for travel and other things?
Yeah, it's really a situation where a state does that. It gives you the opportunity for reimbursement costs potentially. Right now, we haven't seen the storm yet. Certainly look for our advisories that we'll give out. And I think we know what we're doing. I mean, things start to come down pretty hard and pretty fast. Then certainly modify your travel plans, be safe. But right now it looks like we're not going to get hit by this storm the way that our friends in the Hudson Valley and Long Island and New York City are. This looks like it will just be a consistent snowfall for a period of time. And again, as long as this thing's not 2 inches per hour for an extended period of time, our plows should be able to keep up with it. Other questions? Okay, so for what we are going to do tomorrow, we get our vaccine. We'll be communicating with everybody related to what new appointments will look like, and certainly our friends, our seniors on list. We need you to check your email a couple times a day, so that if you get appointment slots emailed to you, you are there to take advantage of those. We'll have phone banks as well, but certainly we want to make sure that you're checking it a couple times again, And if a loved one did it, please check for your loved one so that they get their shot if they're selected, because that will be a good email to get in your inbox. So again, everybody else, please be safe and drive safe. We'll update everybody on the snow and the storm if it as it kind of happens. Thank you.